Welcome to this quick video presentation on ICD10 manual mortality coding, which is part of the video series on ICD10 manual mortality coding. In this video, we will focus on explaining the starting point steps 6 through 8. Please consider watching all videos in the series to improve your understanding of ICD10 manual mortality coding. If you are interested in learning more on related cause of death topics, medical certification of cause of death and automated ICD coding, please consider watching the informational videos also available on the Unit for Strengthening Cause of Death Data YouTube channel. My name is Dr. Yusuf Hamed, and I'm a gynecologist and public health consultant based in Tanzania, but with experience in training coders in many countries. I support ICD10 manual mortality coding trainings for new and experienced coders and have extensive experience in training doctors to correctly report cause of death on medical certificate of cause of death forms. In this quick video, I will explain some basic concepts on ICD mortality coding that are important for coders and stakeholders engaged in cause of death activities to understand. In the previous series of ICD coding, we covered basic guidelines to assign ICD codes to all conditions entered in the death certificate. Then we applied steps SP1 to SP5 to determine whether any of these instructions apply. This is called multiple cause coding, which permits in-depth analysis of cause of death to ascertain, for example, complications of certain causes and the impact of coexisting conditions on the outcome of a disease process. In mortality coding, both the underlying cause of death and multiple causes are recorded. Multiple cause coding is essential for a correct application of ICD instructions for selection and modification of the underlying cause of death. The first, that is steps SP1 to SP5, allows for the selection of a tentative starting point, and the second, steps SP6 to SP8, allow for reselection if necessary of a new tentative starting point, both before modification using steps M1 to M4. Remember, when we completed steps SP2 to 5, the following instruction was, next go to step SP6. Let's look at step SP6, obvious cause. Synonyms of obvious cause include direct consequence and direct sequel, or DS. Obvious cause means that there must be no doubt that the tentative starting point was caused by other condition mentioned on the certificate. That is, a disease condition that unquestionably exists after and is the result of an earlier stated disease condition. It is not sufficient that the sequence would have been accepted if the tentative starting point has been reported as due to the other condition. Sometimes a condition B is considered an obvious cause of a condition A because of importance for public health, but not from medical point knowledge. Therefore, always follow the instructions in section 424. Now, check whether the tentative starting point you selected in step SP2 to SP5 was obviously caused by another condition on the certificate. If the tentative starting point is in part 1, then this other condition must be either on the same line or further down in part 1. In this case, steps SP1 to SP5 are applied to get the initial tentative starting point. Peritonitis causes sepsis, but peritonitis is a direct consequence of necrosis of intestine, step SP6. Necrosis of intestine is the tentative starting point. In this case, steps SP1 to SP5 are applied to get the initial tentative starting point. Cerebral infarction cannot cause liver metastasis. Liver metastasis is the tentative starting point. But stomach cancer is an obvious cause of liver metastasis, step SP6. And stomach cancer is a new tentative starting point. If the tentative starting point is in part 2, this other condition must also be in part 2. Do not look for obvious causes in part 1. Continue looking for a new tentative starting point until you find a starting point that is not obviously caused by a condition reported on the same line or further down on the certificate. Then go to step SP7. In this case, steps SP1 to SP5 are applied to get the initial tentative starting point. Sepsis can be caused by peritonitis. Peritonitis is the tentative starting point. But necrosis of intestine is an obvious cause of peritonitis, step SP6. So, necrosis of intestine is the new tentative starting point. Next, mesenteric infarction is an obvious cause of necrosis of intestine, and mesenteric infarction is the final starting point. If a condition A has a longer duration than a condition B, then condition B cannot be the obvious cause of condition A. In this certificate, the kidney disease existed before the diabetes, and therefore SP6 is not applicable. If there are several conditions that could be obvious causes of the tentative starting point, select the first mentioned condition. In this case, sepsis can be caused by peritonitis, and peritonitis is the tentative starting point. Next, both mesenteric embolism and ruptured appendicitis are obvious causes of peritonitis. Because mesenteric embolism is mentioned first, it is the new tentative starting point. Ill-defined conditions are symptoms, signs, abnormal results of clinical or other investigative procedures, and conditions which no diagnosis classifiable is recorded. The reasons for ill-defined conditions being reported on MCCD forms may be due to missing information regarding the death cause or lack of training on the person certifying the cause of death. Ill-defined conditions are listed in Annex 7.3. The following conditions are not ill-defined: R572, septic shock; R650, systemic inflammatory response syndrome of infectious origin without organ failure; R651, systemic inflammatory response syndrome of infectious origin with organ failure; R95, sudden infant death syndrome, are not considered ill-defined. Ill-defined condition may have an impact on how other conditions on the certificate are coded. The proportion of deaths assigned to this category is an indicator of data quality. If the tentative starting point is not ill-defined, go to step SP8. If the tentative starting point is ill-defined, list of ill-defined conditions are in Annex 7.3, then proceed as follows. If there is at least one condition that is not ill-defined, disregard the ill-defined condition, go back to step SP1 and select another starting point, as if the ill-defined condition had not been mentioned on the certificate. In this case, apply steps SP1 to 5 first, then apply step SP6. Respiratory failure is the only condition mentioned in part 1, and it is the tentative starting point according to steps SP2 and SP6. But respiratory failure is in the table of ill-defined conditions. So disregard respiratory failure and restart the selection procedure from step SP1. Mesenteric embolism is the new starting point according to step SP1. In this case, HIV test positive R75 is ill-defined and causes cytomegalovirus hepatitis, SP3. Ill-defined HIV test positive R75 is ignored. Select cytomegalovirus hepatitis, which combines with R75 to HIV disease resulting in cytomegalovirus disease B202 as the underlying cause of death. See the alphabetical index. Note, the ill-defined condition R75 has impacted on how cytomegalovirus hepatitis is coded. If all conditions reported on the certificate are ill-defined, go to step M1. In this case, all conditions are ill-defined. SP3 R064 causes R290. The tentative starting point is hyperventilation by step SP3, and that step SP7 is not applied. In this case, conditions in lines A and B are ill-defined. Next, go to step M1. Conditions that are unlikely to cause death usually do not by themselves cause death. These conditions are listed in ICD10 volume 2 annex 7.4, but 1. Sometimes in addition to the condition unlikely to cause death, there is another reported condition on the certificate which can cause death. 2. Treatment of a condition unlikely to cause death can cause a fatal reaction. 3. Condition unlikely to cause death can cause another fatal condition or complication. Check the certificate if it has conditions unlikely to cause death. If there is another condition on the certificate which is not in the table, disregard the condition unlikely to cause death and restart the selection procedure from step SP1. The condition which is not in the table is a new starting point. In this case, hearing loss is the tentative starting point according to step SP2, but hearing loss is in the table of conditions considered unlikely to cause death. Ischemic heart disease is not in Annex 7.4. Disregard hearing loss and restart the selection procedure from step SP1. Ischemic heart disease is the new starting point. If there are other conditions reported that are not ill-defined or are unlikely to cause death, first check whether the death was caused by a reaction to treatment of the condition unlikely to cause death that you selected as the tentative starting point. If it was, then select the reaction to treatment as the starting point. Next, go to step M1. In this case, migraine type headache is the tentative starting point. Step SP3. It is in the table of conditions considered unlikely to cause death. The condition was treated with paracetamol and there was a reaction to the treatment, i.e. liver failure. Disregard the condition unlikely to cause death and select liver failure as the starting point. If the death was not caused by a reaction to treatment of the condition unlikely to cause death, check whether the condition was the cause of another condition or complication that is not on the list of conditions unlikely to cause death and that is not ill-defined. If it was, then the condition unlikely to cause death is still the tentative starting point. Next, go to step M1. In this case, caries is the tentative starting point according to step SP3. It is in the table of conditions considered unlikely to cause death, but in this case, it caused complications that are considered unlikely to cause death. Because of that, select caries as the starting point. In this short informational video, We have reviewed starting points 6 to 8 that are described step by step in ICD-10 Volume 2, Section 421. Please review this video again in the ICD-10 Volume 2, Section 421 to ensure you understand these 3 steps. We have covered steps 1 to 5 in another informational video. Please review and watch all videos in the series to develop your understanding and skill in ICD-10 manual mortality coding. Additionally, please go to the Unit for Strengthening Cause of Deaths website to complete coding exercises to test your knowledge. Thank you and goodbye.